Blood pressure refers to the force exerted by circulating blood against the walls of the blood vessels. It is an essential physiological measurement that indicates the health and functionality of the cardiovascular system. Blood pressure is measured using two values: systolic pressure, which represents the force when the heart contracts and pumps blood, and diastolic pressure, which reflects the force when the heart is at rest between beats. Normal blood pressure typically falls within a range of 1/128th of a millimeter of mercury. High blood pressure, or hypertension, occurs when the force against the blood vessel walls is consistently too high, leading to potential health risks such as heart disease, stroke, and kidney problems. On the other hand, low blood pressure, or hypotension, can cause dizziness, fainting, and inadequate blood flow to vital organs. Maintaining a healthy blood pressure through lifestyle modifications, medications, and regular monitoring is crucial for overall well-being. Blood pressure is measured using a device called a sphygmomanometer. The process involves wrapping an inflatable cuff around the upper arm and then inflating it to temporarily stop the flow of blood in the brachial artery. As the air is slowly released from the cuff, a healthcare professional listens to the sounds of blood flow in the artery using a stethoscope. The first sound heard is the systolic pressure, which indicates the maximum pressure in the artery when the heart contracts. The pressure at which the sound disappears is the diastolic pressure, representing the minimum pressure when the heart relaxes between beats. These measurements are expressed as millimeters of mercury, mmHg, and provide valuable information about a person's cardiovascular health. Systolic pressure is a term used in medical and physiological contexts to describe the maximum pressure exerted by the blood against the walls of the arteries during a heartbeat. It is the top number in a blood pressure reading and is an important indicator of cardiovascular health. Systolic pressure is influenced by factors such as heart rate, blood volume, and the elasticity of the arterial walls. High systolic pressure can be a sign of hypertension or other underlying health conditions, while low systolic pressure may indicate reduced cardiac output or other cardiovascular issues. Monitoring systolic pressure is crucial in assessing overall cardiovascular function and identifying potential health risks. Diastolic pressure is a term used in the context of blood pressure measurement, referring to the lower number in a blood pressure reading. It represents the pressure in the arteries when the heart is at rest between beats, indicating the minimum force exerted by the blood against the arterial walls. Diastolic pressure is an important indicator of cardiovascular health, as high levels can indicate the presence of conditions like hypertension or heart disease. Monitoring and maintaining a healthy diastolic pressure is crucial for overall well-being and preventing the risk of various cardiovascular complications. For example, if your blood pressure is 140/90 inches or 140/90ths of a millimeter of mercury, it means you have a systolic pressure of 140 millimeters of mercury and a diastolic pressure of 90 millimeters of mercury. High blood pressure, also known as hypertension, is a medical condition characterized by the force of blood against the walls of the arteries being consistently too high. This condition is often called the silent killer, because it usually has no symptoms but can lead to serious health problems such as heart disease, stroke, and kidney failure. Risk factors for developing high blood pressure include age, family history, obesity, unhealthy diet, lack of physical activity, and excessive alcohol consumption. Lifestyle modifications, such as maintaining a healthy weight, following a balanced diet, regular exercise, reducing sodium intake, and managing stress, can help control and prevent high blood pressure. In some cases, medication may be necessary to manage blood pressure levels. Regular blood pressure monitoring and routine medical checkups are crucial for early detection and proper management of this condition. Low blood pressure, also known as hypotension, refers to a condition in which the blood pressure in the arteries is lower than the normal range. This can lead to symptoms such as dizziness, fainting, fatigue, and blurred vision. Various factors can cause low blood pressure, including dehydration, medication side effects, certain medical conditions, and hormonal imbalances. While mild cases of low blood pressure may not require treatment, severe cases may necessitate medical intervention to raise blood pressure levels and alleviate symptoms. It is important to consult a healthcare professional for proper diagnosis and management of low blood pressure.